Knee valgus by Allison Rodson. Pre-assessments. This includes static posture analysis, dynamic movement assessment, range of motion, and manual muscle testing. To begin, the static posture analysis will be looked at. The anterior view shows left knee valgus. The lateral view has no findings. And the posterior view also shows left knee valgus. Next is the dynamic movement assessment. The anterior view shows left knee valgus, the lateral view has no findings, and the posterior view also shows left knee valgus. From the overhead squat, we can identify what muscles are overactive and underactive. In this case, for knee valgus, the overactive muscles include the adductor complex, the biceps femoris short head, the TFL, the lateral gastrocnemius, and the vastus lateralis. The underactive muscles for knee valgus include the medial hamstrings, the medial gastrocnemius, the gluteus medius and maximus, vastus medialis, and the anterior and posterior tibialis. With this, range of motion is assessed. Hip abduction, hip internal rotation, and ankle dorsiflexion. For hip abduction, this tests the client's gluteus medius and minimus, the TFL, and the sartorius. Normal range of motion is 40 degrees. This patient's hip abduction range of motion is 20 degrees. For hip internal rotation, this tests the client's gluteus medius and minimus and the TFL. Normal range of motion is 45 degrees. This patient's internal rotation range of motion is 30 degrees. Lastly, for ankle dorsiflexion, this tests the anterior tibialis. Normal range of motion is 20 degrees. This patient's ankle dorsiflexion range of motion is 15 degrees. Manual muscle testing. For knee valgus, the gluteus medius and maximus, medial hamstrings including the semitendinosus and semimembranosus, and the anterior tibialis will be tested on a 5-point grading scale. Here, the gluteus medius manual muscle test is being performed. The client receives a 3, for the client has a hard time taking additional resistance. Here, the gluteus maximus manual muscle test is being performed. The client receives a grade 3. Here, the semitendinosus and the semimembranosus manual muscle test are being performed. The client receives a grade 3. Lastly, the anterior tibialis manual muscle test is being performed. The client receives a grade 2. With the pre-assessments complete, the corrective exercise strategy can be developed utilizing NASM's corrective exercise continuum. Step 1. Inhibit. This is done by using the self-myofascial release technique. The lateral gastrocnemius, adductor complex, biceps femoris short head, and the TFL IT band muscles will be the focus for this step for knee valgus. Hold the tender area for 30 seconds. Step 2. Lengthening. This is done by using a static stretching technique. The muscles that are focused on in this stage is the lateral gastrocnemius, the adductor complex, biceps femoris shorthead, and the TFL. Hold this stretch for 30 seconds. Step 3. Activate. This is done by using an isolated strengthening technique. The muscles that are focused on in this stage for knee valgus is anterior and posterior tibialis and the gluteus medius and maximus. 10 to 15 reps with a 2-second isometric hold and 4-second eccentric contraction is recommended in this stage. Step 4. Integration. This is done by using an integrated dynamic movement. The exercises prescribed for this client with knee valgus is wall jumps, 2 feet long jump, single leg glute bridges, and standing lunges. Some more complex exercises that are not included in this continuum is the tuck jump, 80-degree jumps, or cutting maneuvers. 10 to 15 reps should be performed under control for this stage.